Hi, I'm Dr. Seema, currently heading the Department of Psychiatric Social Work at Institute of Mental Health and Neurosciences, IMHANS, Calicut. By the end of first year of MSW course, most students will be at a juncture wherein they have to decide on their specialization. Many of the colleges offer medical and psychiatric social work as a specialization. I hope somebody else will be talking in detail about medical social work. I'll be discussing about psychiatric social work. It's just a brief introduction about psychiatric social work which I am going to do in this video. Psychiatric social work is a specialization in social work wherein the methods and principles of social work are applied in the field of psychiatry. That is the simplest definition of psychiatric social work. Before coming to know what psychiatric social work is, we should know about the transition that has happened in the field of psychiatry. So most of us might have heard about the deinstitutionalization movement that has happened in the late 19th century. Till then, persons with mental health persons with mental health issues were treated in closed asylums wherein the treatment modalities were mostly very brutal. So by the end of 19th century, these patients who were in mental health asylums for a long period of time was discharged to the community, and it was a big movement in the history of psychiatry. This happened because of the advent of the new antipsychotic drug called chlorpromazine. But the expectation was when we discharge these people who are in long time stay in mental health asylums to the community, they will be improving, was the assumption. But contrary to their assumption, many of the patients who were discharged from these psychiatric settings were soon to be readmitted due to a relapse in their symptoms. Studies have found that families play a major role in recurrence of symptoms in certain patients. Here comes the biopsychosocial model. Interaction between a person's genetic makeup, that is the biology, mental health and personality, the psychology part, and the socio-cultural environment contribute to their illness experiences, was the core element of the biopsychosocial model. Here, under the biological title, we have the genetical predispositions of a person, the infections they might have had while they were in their mother's womb, or the chemical imbalances that has happened in the brains of individuals, the nutritional levels or the nutritional deficits, hormone changes, etc., constitute the biological makeup. Under the socio-cultural makeup, lack of social support, cultural beliefs related to mental illness, high-risk behaviors learned from the peer group, etc. were the factors considered. And any other factor among the above may not be the contributing factor, rather it is a combined effect of many factors. So we cannot say it is purely because of genetic or purely because of personality or psychological makeup or purely because of socio-cultural makeups, but it is actually a combination of many of such kind of factors. Coming to psychiatric social work, the aim of a psychiatric social work is to promote social functioning of persons and families with mental illnesses to achieve and sustain optimal level of well-being. So what are the objectives of psychiatric social work intervention? As in the case of any other medical model, the main objective is, of course, the patient welfare, then the recovery from a long-lasting mental health condition, rehabilitation of persons who has been under treatment for a long period of time, well-being of persons and the family members, and empowering the persons with mental health issues and their family members. Here, while working with family, the psychiatric social workers generally focus on enhancing the social support, because most of us know that even in the modern era, there are lots of stigmas related to mental illnesses, and people who are suffering from mental illnesses and their family members are still being treated differently. Like they are not always included in the mainstream. So the stigma is still prevailing. Because of this prevailing stigma, most of the time the social support is not that good for people with mental health issues. Then the second point is managing crisis situations. So when a crisis occurs, a crisis can occur when a person is dangerous to himself or to the society. Because of the variations in the symptomatology, a person who was stable till then can flare up with the symptoms, and at that period, the family members may not know what exactly need to be done. So here comes the importance of crisis management or managing crisis situation. Then the next point is handling burden. When a person is mentally ill and the family is taking care of them for a long period of time, there can have burden on the family members. So how to handle this burden, how to enable the family members to move forward with these kind of people at home. Then prevention of threat to life of persons and others, that I have already told. Here, the psychiatric social worker's focus is actually the person in the context, and the approach is, as I have told in the previous slide, it is biopsychosocial approach. And usually, a psychiatric social worker's practice is in the multidisciplinary team of professionals. So, what is a mental health setting? We have told that a psychiatric social worker is a person who is using the methods and fields of psychiatric social work in a mental health setting. So what is a mental health setting? A mental health setting can be a hospital, a clinic, an institution, or an organization catering to the needs of people with mental health issues. As per the Mental Health Care Act of 2017, a mental health establishment is any health establishment including Ayurveda, Yoga, Naturopathy, Unani, Siddha and Homeopathy meant for the care of persons with mental illness, where persons with mental illness are admitted and reside at or kept in for care, treatment and rehabilitation, either temporarily or otherwise. I would like to briefly discuss the impact of mental illness on a person's life and the family member's life. Mental illness affects the appearance, behavior, thinking, feeling of a person. It may affect the personal life and the social life of the individual, and the psychosocial issues faced by people having mental health concerns are difficulty in handling thoughts and emotions. At times they will have unrealistic perception about a situation. They may have poor judgment and they may not have insight what problems they are actually having. Then they can have impaired self-awareness, have difficulty in communication, difficulty in taking a decision and solving a problem, difficulty in initiating and maintaining a purposeful relationship, and decreased socio-occupational functioning. This are at the individual level, and at the family level, ignorance of a family is a major psychosocial factor. Ignorance in the sense many of the family members may not be aware of the current condition of the patient. There are certain family members who doesn't believe that the patient is mentally ill. They tend to believe that the person's personality is such a way that he is creating trouble to others. There are certain other people who believe that there is a problem, but they consider traditional faith healing methods as a treatment modality. And there are certain other group of family members who know that there is an illness, but because of the stigma attached to the mental health issues, they may not take the patient to a treatment center, or even if they takes, they are reluctant to continue the treatment in future. So stigma is also being the same state, and caretaker burden, and at times a family member may face a deficit in the skill of a patient, like a patient who was already been working in a particular job because of the illness is losing the capacity to work in the same situation. That could be because of the deficits in the skills he has having. So we may have to tell the family how to train or how to bring the patient for further therapies to enhance his deficits in skill, or to enhance the skills and to eradicate the deficits. Then a lack of social support is at another important point, and lack of availability, accessibility, and affordability of mental health care is another issue while considering the psychosocial factors of family. Financial difficulties, of course, is another hampering factor. Coming to the definition of a psychiatric social worker. So, the Mental Health Care Act of 2017 has clearly told that a psychiatric social worker should have certain qualifications. Till the initiation of the Mental Health Care Bill and the Mental Health Care Act, it was assumed that a person having masters in social work uh, with medical and psychiatry specialization can be considered as a psychiatric social worker. But later, with the advent of the Mental Health Care Act in 2017, it was clear that a person with a master's degree in social work is not to be considered as a psychiatric social worker. To be called as a psychiatric social worker, a person should have a postgraduate degree in social work and a master's degree of philosophy in psychiatric social work, or MPhil in psychiatric social work, that too obtained after completion of a 2-year full-time course which includes supervised clinical training from a recognized university. So now a person can practice as a psychiatric social worker only if they have MSW degree plus 2-year full-time MPhil degree in psychiatric social work. Why to have this specialized training? Many of us after our MSW course has been practicing in different psychiatric settings. So I was also under the assumption that MSW with medical and psychiatry specialization itself is enough to work in a psychiatric setting. But when I did my MPhil, I could make out that the information or the knowledge we gain during our MSW time is not adequate to handle mental health situations. So work is very challenging and demanding. Here the psychiatric social worker work closely with individuals suffering from complex and hard to manage conditions, and people who are in deep emotional distress and who may be a danger to themselves or others. So, common sense therapies don't actually work and may do harm than good to clients. So, having an MSW degree and an exposure to psychiatric setting is not actually adequate to deal with complex mental health issues which are dealt in a psychiatric setting. Psychiatric social work is considered as one of the essential disciplines in the field of mental health and has grown significantly in the last 5 decades. The biopsychosocial model has approved the role of a psychiatric social worker, and many of the medical persons like psychiatrists and other medical officers are aware of the psychosocial part of a mental health issue. So since the last 5 decades, it has been approved, and many of the psychiatric settings has a psychiatric social worker working with them. In the current clinical practice, psychiatric social worker forms an important and integral part in the psychiatric treatment. What are the methods that a psychiatric social worker use in their work? Individual counseling or individual based interventions, family counseling or family interventions or family therapy, group work, counseling and group therapy, community based interventions, welfare administration, social action and lobbying are the methods which are used by a psychiatric social worker. You can relate very well with that of the methods of social work. A psychiatric social worker do a psychosocial assessment of the patient, then may have to do a psychoeducation wherein the social worker, psychiatric social worker imparts information about the illness, the causative factors, the course of the illness, the nature, and the possible prognostic indicators of an illness to the patient and the family members. As I have earlier mentioned, the social skills training is yet another job. Then rehabilitation services, facilitating welfare schemes for persons with mental health issues and building social support is the main focus of people having psychiatric social work background. Coming to the tools used in psychiatric social work interventions, interview is the first and foremost tool used to elicit information and to formulate the psychosocial management plan. So here we use the structured assessment questionnaires, and while assessing the psychosocial situations and the causative factors, we formulate a psychosocial diagnosis, and based on that diagnosis, the therapeutic interventions needed for the patient are formulated. At times, home visits are also being done by psychiatric social workers to elicit complete information about a person and the situation wherein the patient is living. What are the settings wherein a psychiatric social worker work, and what are the type of interventions they give? De-addiction is one of the major area of work of a psychiatric social worker, wherein motivational enhancement strategies are given to people with addiction disorders. Then relapse prevention is yet another intervention which we do. For children and adolescents, we do the life skills training. For small children and adolescents with behavioral problems, behavioral modification techniques are being taught. Cognitive behavior therapy or CBT is being administered for people with cognitive distortions like persons having depression or obsessive compulsive disorders. Family therapy for have families having conflict between the members, and sometimes workplace based interventions are also being done by a psychiatric social worker. Psychiatric social workers in psychiatric settings usually involve in the training of other professionals, wherein the psychiatric social worker explains to the team members what exactly is the nature of work of a psychiatric social worker, make home visits as part of treatment process, undertake research activities in the area of psychiatric social work, prepare documentation in the field of psychiatric social work, and create awareness of legal administrative issues involved in psychiatric social work. So to conclude, psychiatric social workers are essential members of a psychiatric care team. Trained and skilled psychiatric social workers would accelerate the recovery and rehabilitation process among persons with mental illness. A small advice for people before opting psychiatric social work as their career. Nobody will come to you to discuss their happiness with a psychiatric social worker. It is from morning 9 a.m. or till the end of your working hours, you will be listening to sad stories, troubles, problems, and negative emotions which a patient or the family members are undergoing. So never ever expect happy moments in your professional life. If you have the strength to tolerate all these negative emotions, then only you choose psychiatric social work as a career. Thank you.